I'm Professor Ziad Hawamdeh from the University of Jordan, Faculty of Medicine. My talk tomorrow will be about rehabilitation of elderly in Jordan. And I will talk about aging, which is characterized by deterioration and decline in functional properties of cells, organs, and tissues, leading to decrease in their capacity to adapt with external and internal stimuli, and this will lead to increased vulnerability to diseases and mortality. So aging, usually it will affect all the systems of the body, including nervous system, musculoskeletal system, genitourinary system, digestive system, auditory and vestibular system, and it will affect also vision. Regarding muscles, when we talk about the effect of aging on the muscles, we will have a progressive decline in the muscle strength and power, and this decline will increase with age. And this will lead to different problems for elderly people, leading to affection of their functional capacity, affection of their balance, and increased risk of falls. With aging also, we will have increased risk of osteopenia and osteoporosis, and the risk of postmenopausal osteoporosis, as we know, is very high, especially when we are talking about osteoporosis, and it is a complication in elderly, like fractures and a lot of complications that can affect the quality of life of elderly people. We have also problems of the auditory system, decrease the ability of hearing, and decrease the visual capacities, which also increases the risk of falls. We have problems of the gastrointestinal system, including dysphagia. We have problems of the genitourinary system. So aging will affect all systems of the body. When we talk about aging and elderly people, we are talking about 12% of the population of the world, and by 2050 this will increase to about 20% of the population of the world. We are talking about 900 million people in the world, and this number will be about 2 billion by 2050. In Jordan, nowadays we have about 600,000 people more than 60 years of age, and those people need high care, and the intervention of rehabilitation specialists is very important in elderly population. Rehabilitation usually starts in the acute setting after hospitalization as inpatient in the acute rehabilitation phase. Then we proceed with the subacute rehabilitation, and we follow up our patients at long-term rehabilitation, either at home or in rehabilitation centers. Rehabilitation interventions include prevention and management issues. Prevention focuses on integration of exercise and physical activity as a part of daily activities for elderly, so that if we integrate the exercise in the activities of elderly people, we decrease the risk of complication. Recommendations for exercise, including frequent aerobic exercise programs that include exercises that increase the heart rate and respiratory rate for at least 30 minutes for 5 days a week. Exercises also that increase muscle strength, including resistive exercises, can be integrated in 2 to 3 consecutive days per week, and balance exercises are also necessary in order to decrease the risk of falls in elderly. We have other issues regarding environmental modifications also, either at home or in the community, to decrease the risk of falls for elderly people. We can also prescribe assistive devices in order to increase the stability, and we can prescribe orthosis. Pain management also is essential part of rehabilitation in elderly people, as many of them, they have complaints of pain, and we can start with non-pharmacological treatment, and we can proceed to pharmacological treatment. So rehabilitation of elderly people is nowadays of utmost important, and it should include multidisciplinary team, including the physiatrist and other rehabilitation member specialists, as physical therapist, occupational therapist, orthotist, and prosthetist, and other members of the team if they are needed. And thank you.